welcome to our live Q&A for our 2022 Client Appreciation event. We're going to be answering all questions MedSpa relating to our specials today. And today we have Haley, Shalene, and Nicole, as well as I, to answer any questions that you might have about any of the services that we offer here at ZMedSpa and ZFA. So I guess we're waiting for our first question, and
all right. Anytime you guys have a question, go ahead and type it in the comments, and we will relay it to the providers. I do have one coming in about how often do you recommend Sculptra?
So that's a good question. Sculptra is a biostimulatory injectable, not really a filler, and it takes some time for you to notice the results. So every 4 to 8 weeks, we can inject a certain amount of Sculptra depending on the area in which we inject. So Sculptra is very versatile. You can use it basically anywhere in the body, anywhere on the face to restore lost collagen, build collagen, and eliminate sort of fine lines or wrinkles, specifically in the chest and the décolletage. You can use it in wrinkly knees. You can use it on the face for foundational stuff on the to build volume. So depending on how many vials you would need, on average, people in their 40s to their 60s need anywhere from 4 to 6 vials, depending on the amount of skeletal bone loss or volume loss. And so, once every 6 to 8 weeks, you would come in. Usually, it's a 4-month process to get you up to where you need to be.
And how long does Sculptra last? Someone's asking.
So the original studies that were performed show that it lasts around 3 to 5 years. And so that's what we've been noticing here as well.
Are there any other areas where you guys use Sculptra?
So we talked about face, we talked about knees, we talked about the décolletage for the fine wrinkles, and then buttock enhancement as well. So you've probably seen a lot of that on Instagram. Some people who don't have enough fat to augment this area, or people who are scared of the risks of surgical BBL are good candidates for Sculptra here. However, the amount of Sculptra needed for enhancement here is a large amount, anywhere from 12 to 20 vials is sort of standard.
We have a question of, do you have any lasers for tightening facial skin, specifically eyelid skin, like CO2, for example?
So we have an erbium laser, which can actually mimic a CO2. We prefer it because you can take the heat in or out. So as far as facial tightening, some of the specials that we have today are the micro laser peel. It uses a 2940 wavelength that is completely ablative. So you're going to see a lot of facial tightening. You are going to see a lot of diminished sun damage and just an overall rejuvenation of the skin. A good thing about erbium laser is that it's definitely customizable too, depending on the depth. So we really like to find out what our patients' expectations are as far as downtime, as far as if they want to do a series and start more gradually to do a couple smaller treatments and work up to something that's a little bit more deep. But then there comes more downtime with that. So it's just finding out what our patients' expectations are, and we can definitely customize a plan for you.
The other thing that's good about erbium is that there's not a lot of additional heat as there is with the CO2 laser. Fractionated CO2 lasers are great, but to get deeper, a lot of the problems with the old CO2 lasers, which were purely ablative and not fractionated, is that they cause a lot of hypopigmentation. So you probably see some people where they have a white area around their mouth when they hit CO2 laser, or there's a line of demarcation over their cheek to their neck. So the
helps stimulate collagen. It's referred to as collagen induction therapy. So you can expect to see a little bit of tightening and all over refreshed look. Microneedling works best in a series of treatments. Typically, when we're starting out, I typically recommend you start with 3. But it'll help with fine lines, wrinkles, tone, texture, pore size, all of that. There's minimal downtime with microneedling too, so if you are someone who's always on the go or works in office, this is a really good treatment for you. You can expect to be mildly red for about 24 to 48 hours. Adding in PRP with microneedling too is a good enhancement as well, just to stimulate a little bit more of your natural collagen.
And what's the downtime with it?
Typically 24 to 48 hours for downtime of microneedling.
I think you kind of just answered this, but someone's asking about, and this is in regards to our specials today, what the PRP add-on is and what that could be good with.
The PRP add-on, we kind of just wanted to make it a blanket add-on across every single med spa procedure that we offer because you can add it to any single procedure. So if you're doing the regular microneedling special, we just use a hyaluronic acid glide, which is wonderful. But if you're looking to kind of speed up or augment the healing process, get a little bit more collagen stimulation, then we have that PRP add-on bonus for you. PRP is great with any of the lasers because it works in that same way too. So if you're getting the Halo special, the BBL and micro laser special, the Morpheus 8 special, or the microneedling special, and you want to add on that PRP, it's there for you and it's a great option.
So separate from PRP, we get a lot of questions, and we're getting a couple today about PRF. So Nicole, do you want to explain what is PRF?
Yeah, so PRF is kind of a hot term right now. We're seeing it a little bit more in the aesthetic realm, but it's been around for a while. It's still using your blood like PRP, but we're using the fibrin matrix. So what that does is allow for a slower release of the growth factors that you find in the PRF. So you get added benefits over the course of weeks. PRP is great for an initial treatment, like Shalene had said, right after laser, because it's going to work right away. The PRF, once it's injected into the skin, it's going to just release slowly over time. Typically, when we do it, we again want to do a series of 3, and then just you can continue it however long you want to do it. If it's something you want to do once or twice a year, then that's fine. It's just for facial rejuvenation.
A question did come in about PRF. Do you worry about the veins around the eyes when you do a PRF?
No, I mean, we try to mark those veins. Really, what we're doing when we do PRF around the eye is that we're using a cannula, which is a blunt tip needle, and the entry point it's quite a distance from those veins, and obviously we want to try to avoid it. If you do happen to hit a vein, you might get a little bruise there. So obviously we try our best. We don't intentionally bruise anybody, but when we're sticking needles in the face, that can happen.
Well, the also thing to understand is the area around the skin on the eyes is the thinnest.
Yes.
And so the incidence of bruising around the eyes from filler and the lips is quoted at around 60 to 70% nationwide. So it happens. It happens to everybody. We don't want it to happen, and we can use cannulas to help prevent that. Even with cannulas, you can find little bruises here.
Someone is asking, how long does PRF last?
That's a good question. So PRF, once it's placed, the fibrin matrix is going to break down slowly. So over the course of 4 to 6 weeks, it's going to break down and release those growth factors that we all want to help stimulate collagen and elastin. So that's why we do recommend a series. And then after that, it's just a maintenance. So it's not going to last as long as filler, and it will provide some volume, but not the volume that you might see with filler. It's a great option for people who don't want to do filler, or many of you guys know Dr. Z and I are very selective in under eye filler clients, and
have the option of mixing the PRF with an HA product, which will give you an additional lifting capability. So you get the immediate benefits of the filler with adding immediate volume, as well as the sort of longer lasting results for the PRF, which is more using your own body as a biostimulatory, enhancing the ability to erase the darkness around the eyes and eliminating finer lines and wrinkles as well.
And that's one of our specials too, pairing PRF with under eye filler.
And I like to, when we do the PRF with under eye filler, I like to save that filler for that third treatment, because I really want to see what the previous treatments have done to help reduce the appearance of the dark circles and the fine lines and just what volume it has created. And then, you may not need as much filler as what you normally would need without PRF. So,
in general, people who have really crepey skin underneath their eye and are complaining about this region aren't typically the greatest HA candidates.
Right.
So, advanced age, past the age of 50, your skin is thin. Now, people of darker color who are what we call Fitzpatrick 4, 5, or 6, where the skin is thicker and more sebaceous, can handle filler. It's the people who are not, where they have fine lines and crepey and they want filler to take care of that. It's probably not the best idea. That's where we have run into a lot of problems with something called the Tyndall effect, where it looks blue. We find that there's lots of unevenness there and shadows. So the PRF is a great, sort of treatment for those types of patients.
and it's great to combine it with microneedling or laser of the face.
Or Morpheus too.
Yeah, Morpheus as well, just because you're also then getting that needle stimulation to help build collagen. So if you have crepier skin in the under eye, and you're looking to tighten that, combining the Morpheus 8 and the PRF is ideal.
And how Nicole was saying that every time you poke yourself with a needle, sometimes there's the propensity of bruising. With BBL, we can always spot treat to help heal the bruise a little bit quicker too. But is there anything that a patient could do in advance? I know we have Arnica here to help that.
That's a great question. So before you come in for even any injectable or laser, it's important to refrain from using non-steroidal anti-inflammatories like ibuprofen, Motrin, Aleve. Vitamin E and fish oil are good ones to also stay away from. Limit your alcohol intake. The alcohol will thin the blood, so it makes you more likely to bruise. Anything else? You can take Arnica tablets. I would do that probably a few days beforehand. Doesn't guarantee that you're not going to get a bruise, but it can help reduce that.
Just say thank you, Nadia.
Thank you, Nadia.
It says
Shout out.
literally best rhinoplasty surgery. We actually have a couple of questions, still more about PRF. Does PRF migrate and dissolve better over time under the eye?
That's a great question. So does PRF migrate? No, essentially it's your own blood product. So we're drawing your blood, we're spinning that down, and we're injecting that back into your body. If it did migrate, it's going to just rejuvenate that area that it's in. But you're not going to see, like you can see with filler, a migration, or a clump anywhere. And that's the beauty of it. It's your own body, so you have less of those events where you're going to see the filler, or you're going to have maybe a lump or a bump from filler migrating, or just,
They work very differently. So filler is high hyaluronic acid, usually the gels. Radius is not, Sculptra is not. But how HAs work is they hold 1,000 times their weight in water. So that's why it volumizes real quick. It swells, people get sort of crazed out, and it dies down. PRF does not work that way. PRF, it does not hold on to water, except for just a small amount. But it's a biostimulatory. It's got stem cells in it to sort of rejuvenate and repopulate that area. So the problem associated with HA, you don't see those with PRF.
Right. And there really would be no need to dissolve. You can't dissolve the PRF. It's going to go away, and over the course of a few weeks, it's just going to, just continue to
I have a question about threads. Someone asked, can I get threads done if I have a facelift scheduled a year from now?
That's a great question. So can you get threads if you have a facelift coming up? I think a year would be appropriate. These threads that we use for lifting tend to last about 8 to 12 weeks inside, but the effects of the thread are longer, obviously. So the thread is a suture material that dissolves on its own. So the chances of Dr. Z doing a facelift and seeing threads from a year later are very slim.
I've seen people have it like 6 months prior, and it's usually gone. It's made of the same material as Sculptra. It doesn't cause there to be a real scar band at all. It just is PLA, causes stiffening and thickening of the dermis. I've not run into a problem where it makes a facelift more difficult at all. However, in the nose, they're problematic. So I don't recommend putting threads in the nose.
But also, if you have had a previous facelift and you're wanting a little bit more lift with threads, it's really not a great thing to do. You probably won't get the results you're looking for. There's a lot of scar tissue with the facelift, and to get that thread through, it's
correct.
Yeah,
if you've had a facelift before, it's not a good idea that it's too scarred down for any sort of mobile lifting with threads, which are placed in a superficial plane rather than surgery, which is done in a deeper plane.
Now you could use smooth threads though. Those don't have lifting capabilities, but the smooth threads do help to stimulate collagen. They will help to build volume. So people who have some crepeier skin, whether it be the neck or even the lower face, you can place a series of smooth threads to help stimulate that collagen. And I think they're underutilized. We should probably be using those more. But I think most people are just in awe of like the lifting threads. So I always try to talk to people about those smooth threads too, because they're really a good workhorse to stimulate collagen and to, just provide some thickness to the skin.
We had a question, do we do breast reduction surgery? So just answer that real fast.
No, we do not.
Well, you have to repeat the question.
Oh, do we do breast reduction surgery? No, we do not. I'm strictly a facial plastic surgeon, so
Maybe in the future.
I do surgery from the neck up.
Another question was, can I get a hydrofacial if I'm breastfeeding? And if so, do I need to pump and dump?
You can get a hydrofacial while you're breastfeeding. However, I do recommend that you inform me that you're breastfeeding so we can make some adjustments.
Okay, will we have to pump and dump?
It's not necessary.
Okay, to pump and dump.
No, to pump and dump.
Got
It is not necessary.
Okay.
Can I add something to
Yes,
that?
you
So along the lines of if you're pregnant or breastfeeding, we've had multiple people call the office or come in and they're pregnant and breastfeeding and they want their Botox and filler. That is something that Dr. Z and I just don't do. I don't know if people have seen things on TikTok, but I have seen physicians that will inject with, a patient is pregnant or breastfeeding. It's just, we don't do it.
Nobody's going to know if it ever causes a problem because nobody's going to do an experiment on that. So better be safe than sorry.
So if you're pregnant, stick to a hydrofacial.
Yes. And make sure you let the office know.
Yes. The biggest thing with lasers and microneedling is that we don't want to use lidocaine numbing, but I do have some patients who were breastfeeding and opted out of numbing. I would never do a deep laser on them, but for a micro laser peel, we could do the lightest level, like what we used to call a nano laser peel. So it's at a 4, and that is very tolerable without numbing cream. And we do have some patients that can tolerate microneedling at a lighter level without numbing as well. So
we do, you just use we have a cooler,
Chilling
the Zimmer chiller.
Chilling the skin helps with that.
So there are some options of keeping your skin nice and plump and rejuvenated while you're pregnant.
Okay, next question. Best option for lifting the beginning of jowls and a sagging jawline?
So it really depends on your skin quality and your age and what degree in which this is happening. So younger patients who are just seeing it in their 40s can
sorry, someone's saying they're having a hard time hearing. You guys, can you guys just all make sure your microphones are,
Yes.
So try, we
You
can
got
scoot closer too, if we needed to, scoot closer.
and maybe turn the microphones up just a touch.
The other thing that is really great for prevention along the jawline and jowls is Morpheus 8.
Yeah.
And Nicole and I, and Haley and I, we love to do Morpheus 8 in conjunction with fillers and threads, and so it's great to come up with a customized plan. And it's really awesome to take advantage of these specials because you could do something like 1 month, really build the collagen up with Morpheus 8, and then Nicole can come in on a more superficial level and deeper level to stimulate even more collagen with threads.
We're also got a question, what's the difference between Morpheus 8 and microneedling? Who wants to tackle that?
So microneedling is just collagen induction therapy. Morpheus 8 is radio frequency microneedling. So you get the best of both worlds with that. You get the collagen induction therapy with the tiny little needles, but then the radio frequency goes down deeper to create that tissue tightening. So you're gonna get more of a skin tightening with Morpheus 8, but both of them work fabulous. It just kind of depends on what you specifically want to work on.
We're just gonna pull forward because nobody can hear.
We like to say for our patients who are seasoned, they've maybe done microneedling for the past 1 or 2 years, they're looking for a little bit more oomph in their treatment, or like Haley said, a little bit more tightening, then they can kind of graduate onto the Morpheus 8. But it doesn't mean that you can never do microneedling again. It's always good to change it up a little bit, or do a series, take a little break. You can always do microneedling in between Morpheus 8 if you have an event that you're trying to get ready for and you just want an overall really nice peel and glow. But the biggest difference is that tightening factor.
I get a lot of questions, after you do your series of Morpheus 8, is that it? And my answer is usually no. I will have you complete your series and then in a couple of months come back and do either another session of Morpheus 8 or you can just do regular microneedling more frequently. I find that works very well in keeping up with your maintenance.
But people shouldn't be confused as it's not a substitute for a facelift.
No.
It's not gonna lift your jowls and it's not going to get rid of any sort of turkey neck. It doesn't do that. It's mainly for skin texture, tone, and a little bit of tightening. But it's not gonna lift anything.
We got a question, is Dysport as good as Botox and can it be used in the same area?
So Dysport is as good as Botox. It can be used in the same area. Anecdotally, Dysport works a little bit quicker and sometimes can last a little bit longer. You may be surprised when people say you need 150 units of Dysport because it's not an equivalent ratio to Botox. So the conversion factor is 2.5. So if you're getting 25 units of Botox, or 20 units of Botox, you're going to get 50 units of Dysport. So it can be used in all the same places, and yeah, it's just as good.
I think too, it's important to know that though it may kick in quicker, I always tell people, give it a full 2 weeks. I have had times where it's, taken a little longer to kick in than what people say, but it does tend to kick in quicker. And like I said, after 2 weeks, if you're still having a lot of movement or you see some asymmetries, that would be a good time to call to have a follow-up.
Somebody was asking, can you be tan if you have RF microneedling or Morpheus 8?
You can have a tan, but I do not recommend you having a sunburn. You can have sun exposure when you come in for microneedling or RF microneedling, but then afterwards I do not recommend you going back out into, direct sun for at least 2 weeks.
Okay, so I'm gonna try and stand close so you guys can hear. The best laser for preventative care for someone who is 28?
That's a little tricky. We would always say for sure to come in for a consultation, just because everyone is completely different and everyone has different skin and genetics, and it depends what you're targeting. But if you are just getting into the laser world and starting off, probably I would say our micro laser peel, just because it's so customizable. And so for someone in their 20s, you could do a light, a medium, or a deep, depending on what we're targeting, whether it's sun damage, fine lines and wrinkles, or even some acne scarring. So the micro laser peel special is what I would choose. Or microneedling. Like we said, depending on what you're looking to target and the downtime. Microneedling or micro laser peel is what I would say. Is that what you would say?
I also think too, that's a great age, maybe even younger, to start really thinking about your skincare routine too. After a lot of these lasers, you want to maintain your investment, and we can do that. We can help you with that with our cosmeceuticals. So, excuse me. So make sure, when you are getting your laser, that you talk to Shalene or Haley about what I be using topically afterward.
We have some great products that can actually even prep the skin for laser too, to help augment the healing process and just get your skin ready to undergo a big peel. And I think that all our skincare is on special right now as well, so you can always ask any questions about that too.
And the same goes for Botox and filler. We always encourage people to be using, vitamin C, retinol, sunblock. It's important to protect what you're doing to your face.
And right now online, all of our skincare is 20% off. So now would be the time to stock up. Or if there is something that, like a product that we've talked about before, you've seen on our Instagram, or we've talked about and promoted, and you thought that it was maybe a little bit high on the price range, take advantage of the 20% off, especially to prep for any laser services coming up.
Say thank you to Bailey.
Thank you, Bailey.
We're getting a lot of questions about why it's so long to see you for a consultation. So maybe a blanket.
So, it's been very busy, and we do a lot of consults a week. And I'm one person, and these cases do take a long time. So, in any given day, and I operate about 2.5 days a week, I can do at most 3 rhinoplasties, or if I'm doing a full facial rejuvenation procedure, that's basically it. I'm doing a facelift, eyelids, brows. So the wait is long.
But worth
We
it.
think you're worth. I think I'm worth it. So I think other people are too.
And I keep a cancellation list, and I'm very good about keeping it updated.
There's a cancellation list, but that's why the wait is so long. And the wait is long for consults as well, because at most I can do about 5 or 6 a day. I do have to see patients who are follow-up, and I still do filler and Botox and the ancillary procedures as well. So it's not for lack of me working.
If we're gonna clone him, we just need to clone everybody sitting here, and that would be amazing. We also had, I think it's important to address this. There's a couple folks that are wondering if they get something but they're not a candidate. It was mainly about PRF. How do we handle that? I would say, I guess I'll comment on the back end here. If you're not sure if you're a candidate, call the office, and all the providers are here today, and they can try and talk through that with you. So
I don't know many people who are.
Especially for PRF.
Yeah, for PRF, because the risks are very low. The amount of problems where you don't have to dissolve anything. You can't put it in the lips, so that's filler. It's mainly for the mid-face and around the eyes. And neck too. So it's very specific in any areas where you need a lot of volume. You mix that. You do this special with HA to stimulate many, many years in and around the face, but you can use it as well. It's very similar to Sculptra when you hyperdilute the radius. So you're injecting a lot of saline with the radius, and you can inject it into the buttocks, you can inject it in the knees, you can inject it into the décolletage as well. So it's very interchangeable with Sculptra as well, but gives a lot more lifting capability right away than Sculptra does.
Diane said thank you for her amazing hydrofacial last week. We're getting a lot of thank yous, which is awesome.
Yes, we appreciate that.
Yeah, it's amazing.
Love the engagement.
You know, one of the other questions that I also get when I'm out is, can you use BBL for other body parts? And if so, where? And do you do, excuse me, multiple treatments as well?
So yes, you can use BBL for multiple body parts. We do a lot of face, neck, chest, arms too, and yes, you still would need a series of treatments with BBL. Usually we start with 3 and we'll go from there. And it works very well for the chest, arms, all of it, so.
Big thing is do not come in with a tan.
Yes, I won't do it,
Do
neither will
not.
Shalene, so.
Do not. No sun at all for 6 weeks on any body part that you want.
So one will
Treat
be
it.
yes.
I've done a few backs too.
Yeah.
We have some brides that will come in and they're getting ready for their wedding and accumulated a lot of sun damage over the years on their back and shoulders, and that BBL and Halo combo is just the best thing for it.
Another thing that BBL has the capability of doing is treating acne too. So everything that we do, we can customize it for you. So if acne, you know, on the back, I know a lot of people have it on their chest, we can always target that as well.
Yeah, there's a specific filter that kills the bacteria that causes the acne.
We have a question. What's better for anti-aging, Morpheus 8 or PRP treatments?
Well, both, because you can do Morpheus 8 with PRP. As far as anti-aging, with Morpheus 8 and radiofrequency, you're just getting that tightening effect, but if you're looking for an overall rejuvenation of the face, and it's not necessarily a surgical route, I would say what Nicole and I do is Morpheus 8 with threads. The PRP is just going to help you heal a little bit
Yeah,
faster.
PRP is really an add-on unless you're using it for hair restoration. So nobody really injects just PRP on its own. It's very thin. It's the consistency of it looks like chicken broth. You know, it's not going to volumize or really do anything other than you have to have some other stimulatory event for it to really work, other than if you're injecting into the scalp for hair.
And that, the add-on is not applicable for that. The add-on is to be added to the specials that are listed.
Yep, the laser or microneedling. But what we're doing essentially with Morpheus 8 is we're creating those tiny little channels, so then we're topically applying the PRP, so you're getting an augmented healing process.
We got a question. What kind of threads are included in this event? It says the listing is not specific. They just are laid out like that. So maybe you want to address that.
Yeah, thank you. So the special says threads for mid-face, neck, or lower face and jawline. And it's really, everything is a little bit, it's customizable. So for the most part for jowl and the mid-face, we are using lifting threads, so those barb threads. For the neck, it might be a combination, and sometimes it's just the smooth thread. So purchasing the package, you would come in, we would take a look at your face and set your expectations, and decide what you'd be the best candidate for. But primarily, any type of trying to lift a jowl, you are going to use those barb threads.
We have a question. Can you do BBL laser on Hispanic skin with rosacea?
Yes, absolutely. We have different filters for different Fitzpatrick types, we say. So BBL stands for broadband light, and we want to make sure that we're using the correct filter. So for darker skin types, we would just want to see that patient in for a consultation, and we can work on improving the rosacea. Sometimes with darker skin types, it might just take a few extra treatments. So it's a gradual process, so just keep that in mind.
with darker skin touch-up to dial down the energy. So to prevent bad things happening like darkness and post-inflammatory hyperpigmentation. So, you know, it's all customizable, and you know, the filter really determines what you're getting at, as well as the energy level. So darker skin usually means less energy and more treatments.
HRT, yes. So I think just kind of a general dialogue about HRT.
So, HRT is hormone replacement therapy. Our specialist 3 HRT sessions, and then you would get your initial blood draw, complimentary. And what HRT does is it helps men and women both who are experiencing, you know, the decline of their hormones. So whether it be, you know, I'm not sleeping well at night, I'm gaining weight, I'm having hot flashes, I have low libido, low energy, I can't, you know, my workout isn't like it used to be. That is where hormone replacement therapy can come into play. For the most part, I see women probably beginning like late 30s, early 40s and on. So it's around that time that women unfortunately start to feel the effects of the decline in their hormone levels, and so we can help them by, you know, replacing those hormones to an optimal level. And it really just depends on what is going on, and that which determines like which hormones I'm going to use. So a menopausal woman who has nothing will probably replace all 3 of those major hormones: the estrogen, the progesterone, and the testosterone. Or as a younger female, possibly just progesterone and testosterone. And then for males, I have a lot of male patients who we are replacing their testosterone levels. We're getting them up to a more youthful level, like when they were in their 20s. So it's both for men and women. It is pretty customizable. We do pellets here, and pellets, they go underneath the tissue, specifically in the upper buttocks, and they last about 3 to 4 months. So when you're looking at these HRT sessions, you know, that's going to give you at least 3 of those treatments every 3, you know, you'll get one every 3 months.
I had a question about the giveaways that came through a little bit ago. So just to explain a little bit about that, if you made a purchase today, or if you're going to make a purchase, you're automatically entered into the giveaways. And if you are a lucky winner, you will be contacted. Did you guys want to talk about like any of the products or anything like that in the giveaways maybe?
We absolutely can.
These are great giveaways.
They are very good giveaways.
So I will touch on the, so we have gift baskets. One is Elastin that comes with, one of my favorites is Hydra Tint. That is an SPF moisturizer. It's a universal tint, love it. And their gentle cleanser, their restorative skin complex, which is another one of my favorites. It's pretty much replaced my moisturizer, vitamin C, all of it. And then the other one is their eye cream, their restorative eye cream, which is fantastic as well. The great thing about Elastin is it has their Trihex technology, which helps remove old elastin and collagen and helps rebuild. So it's really good when you're doing all these lasers and Botox and everything works hand in hand. So that's a really good one. If you want to talk about.
Let's talk about Botox. So we are giving away a full correction of Botox, 50 units. Now some people might get more than that, but we will give you 50 units, which is awesome. Typical areas for Botox would be between the brows, the forehead, around the eyes. Some people like to do their upper lip to correct a smaller lip and to give the illusion of a fuller lip, or we sometimes do it to help with a gummy smile. So if you're smiling and you're noticing that you're showing a lot of gum, we can use Botox to help reduce that. What else is on here? Oh, gift cards. You want to talk about the gift cards? They're pretty self-explanatory.
Okay, ZO. So ZO, we have our gentle cleanser, which is what we recommend to use after any type of laser or microneedling or Morpheus 8 procedure. Anyone is a candidate, no matter what type of skin that you have. Our Daily Power Defense, which is a wonderful moisturizer with vitamin C that protects against pollutants and antioxidants, and it's just very, very light. So again, everyone would be a candidate for that. Our exfoliating polish, which is one of my favorites. I keep it in the shower and I use that once a week just to help exfoliate the top layer of the skin. Yeah, it feels like a spa. It's amazing.
It smells amazing.
Yes, we're very particular on the skincare that we carry, and we can't carry it all, so sometimes I would even recommend something, well, I take it back, if we recommend something that we didn't carry, we probably would bring it on, but I don't think that one line just has it all, and so we kind of hand selected and hand picked a few of our favorites so that we could cover all the bases of whatever your skincare needs are. But the good thing about these baskets is that they're good for any type of skin. It's not like they're corrective by any means, but really great hydrating products, a great SPF, and really awesome cleanser. And then the other thing that's in the ZO gift basket is the growth factor for the face. And I think it uses growth factor from plants. There's lots of different growth factors out there, but this one is from plants. Oh, and there's a SkinCeuticals one too, I'm sorry. So we have 3 skincare ones. So then in the SkinCeuticals we have the CE Ferulic, which is the best vitamin C out there. Hydrating B5 gel. What I love about SkinCeuticals is you kind of feel like a little chemist when you're applying all these different skincare products to your face because you can mix and match and they come in a little dropper. So for people on the go that don't necessarily have time to do one layer and then wait 2 minutes and then do another layer and then wait another 2 minutes, you can kind of put it all in your hand, rub it all together, push it into the skin cells, and then bam, you're out the door. And then it also comes with a light moisture UV defense, which is our SPF, and a really great eye cream as well. So we have an Elastin, a ZO, and a SkinCeutical. So good luck to all the purchases.
And remember, any package you purchase, you will be entered into the raffle. Yeah, you're automatically entered, so you don't have to do anything except for purchase something.
Yes, and just as a reminder to everybody, our specials are online. If you go to our website, www.zulianimd.com, you can purchase right from the comfort of your own home. If you have any questions, you can call us. You can purchase over the phone too, but we're only here until 5 today. But the specials will be live until midnight, so you have plenty of time. All of the purchases, all of the procedures must be redeemed by March 31st of 2023. So keep that in mind when you're making purchases to make sure it's actually possible that you get all that done by March 31st. And that's about it. If you guys have any further questions that we didn't answer, you can continue to comment below, whether you're watching on Facebook or Instagram, and we will make sure the providers get on and answer those for you. You can always call too. Our phone number is 248-322-3362, and we have everyone here to help you today. So,
Can I just add something really quick?
Yeah.
Sure.
Maybe you can touch on this too. So Radius, this is a great deal, 2 syringes of Radius for $1,300. A lot of people probably have seen Radius being used for the jawline and chin augmentation. I just want you guys to know that the 2 syringes, yes, are great. They're going to get you started. You will probably need more than 2 syringes to really sculpt a jawline or to add that projection. Maybe not so for the, for the chin, but definitely to sharpen that jawline. You will likely need more than 2 treatments.
It's a good start, though.
It is a good start.
And depending on what your aesthetic goals are or what you're trying to accomplish.
Perfect. I think we've tried to capture all of your questions. If we miss someone's question, we apologize because they come through pretty quick. And we're manning a few different platforms right now. So please feel free to call the office, or you can even shoot us like a DM or something if you want to.
we're going to repost these. Yeah, we're going to repost these replays too. So if you missed the live, this will be available for you to watch later, and you can continue to ask questions.
Yes. So we want to thank the Zuliani team, the entire team. Thank you to all the providers for being available today and answering your questions. Thank you to the entire team at large, because without them, this is not possible. And
Thank you to all
and
those who watched today.
thank you, yes, most importantly to our patients, and especially those that took time out to watch this today. And again, our specials go till midnight on our website. We're here till 5. And if you have any questions, please feel free to reach out.